Now we will discuss fundoscopy. Okay, fundoscopy is an important aspect of diagnostic tests in glaucoma. This is because fundoscopy means the evaluation and analyzing of optic disc, which is also called optic nerve head. Okay, so basically glaucoma is the disorder of the optic nerve. So evaluation of the optic nerve head is important. Okay, so we should first understand the normal symmetry and features of the optic disc, and then we will come to the glaucomatous optic disc. That what are the changes in glaucoma? What can be the changes in glaucoma? Okay. So in the normal optic disc, as it is the fundus of the eye. Okay. This is the fundus of the eye. We have the optic nerve head, which is also called optic disc. It is present at the posterior and the medial region of the optic of the fundus. Okay. The normal optic disc, it is an oval or rounded shape structure. We have an oval or rounded shape structure which is about vertical diameter is about 1.7 to 1.5 to 1.7 millimeter. Okay. This optic disc is composed of two parts. The center white region from which these vessels originate. This center white region, this is called optic cup. Okay. And we have this blackish area, this blackish and thick area, this is called neuroretinal rim. So we have the optic cup and neuroretinal rim. Okay. Now the optic cup is white in color. Okay. Normally it is white in color when we look through the fundoscopy. And this blackish area, the dark area, this neuroretinal rim is normally pink or orange in color. Okay. Normally it is pink, it is orange or pink in color. And now we have the optic cup to disc ratio. This optic cup to disc ratio is about, normally it is 0.3 to 0.7. When we take the optic disc to optic cup ratio, okay, optic cup ratio, this will be 0.3 to 0.7, okay, this is the ratio. So these are the normal features of the optic disc. Now the increased intraocular pressure can causes severe changes in this optic nerve head. Okay, these are called glaucomatous optic disc. In glaucomatous optic disc, we first will have nerve fiber layer defect. When we analyze through fundoscopy, we may find the optic nerve layer defect. As we know that we have the ganglions, okay, ganglion layers, and these ganglions of the retina, they will give us fibers. Okay, so we will have nerve. This is the nerve fiber layer, which is the last layer. Okay, so there will be the nerve fiber layer defect. It can be diffuse or localized. Okay, and now we know that this optic nerve, actually this optic nerve head, which is also called optic disc, it is made by these fibers. Okay, this neuroretinal rim, which is pink or orange in color, this is made by these fibers. Okay, they converge and they make this neuroretinal rim. Okay, so when there is the defect of this layer, what will happen? The neuroretinal rim will degenerate. The neuroretinal rim will degenerate and it will expand the central optic cup, and we will have expand and increase optic cup. This is called glaucomatous optic cupping. So with the increased optic cup, the central optic cup, we have the disc to cup ratio will also increase. Okay, will increase from normal 0.7. So first of all, we will have nerve fiber layer defect, which will be followed by glaucomatous optic cupping, and with the cupping we will have increase of cup to disc ratio. Now, as the neuroretinal rim degenerates, okay, so it will change its color from normally it is orange or pink. Now it will look like pale. Okay, so the color will change to paler. The neuroretinal rim will become pale. Now other glaucomatous changes is that there will be, as we have the normal visual symmetry, okay, in the retina, we have the normal visual symmetry like this. So these vessels will cluster up on the medial side, okay, on the nasal side. And this clustering of the vessels on the nasal side, this is called nasalization of vessels. So we will have nasalization of vessels. And remember, as the intraocular pressure is, we have increased intraocular pressure, it is elevated, so this will cause pressure, okay, and this pressure is actually causing all these problems, okay. This pressure can also causes hemorrhages, okay. There can be the hemorrhages in this area, hemorrhages in a special pattern which is in the splinter pattern. So we may have the splinter hemorrhages in this peripapillary area, okay. So these are the optic disc changes in glaucoma. Nerve fiber layer defect, glaucomatous optic cupping, disc ratio is increased, whitish area is increases because of the expanding, okay. We have the pale neuroretinal rim because of the degeneration. We have the nasalization of vessel, and we have the splinter hemorrhages. So these changes may be present in glaucoma, and these all changes depends on the severity and duration of glaucoma. Okay, so this fundoscopy gave us this evaluation of the optic disc and these changes. That's why I told you that it is an important aspect of the diagnosis in glaucoma. Thanks for watching. Guys, I also have prepared notes. I will give you the link in the description. You can go through the notes and can learn more.